urgently implementing universal healthcare because we don't have time. And the health workers are important for this. So the local government must be cognizant of the fact that if they do want health workers to work for them and take care of their people, they have to be supported. No? And I think we've seen quite a few local chief executives that have done this in our models. So for me, a takeaway is if this can be done by some local government units, it should be done by everyone else. No? And for me, really an important message is we have to do all these things now. We might not achieve them all now, but if we start later than sooner, we may lose this chance of implementing universal healthcare. For me, that is the biggest threat because COVID has brought us a lot of opportunities, and one opportunity is to shine the light on all these right things that we have to do by our health workers. If we allow this opportunity to pass, our message might not be too clear. No? So we hope that the press and the media will help us spread this message that the time to act, to value and support your health workers is now. Otherwise, it might be too late and we all lose as a nation. So, thank you.
Thank you, Dr. Lorenzo. Dr. Borromeo, and then Dr. Montacar.
And as we worry about external migration, which has been adequately tackled, so must we also worry about internal migration, the movement of frontliners from the private sector to the government sector, because the salaries are higher in the government sector. So as we worry about them, our nurses leaving for other countries, so must we also manage this movement. Now there are no easy answers. We need to put our heads together, but this conference has given us the opportunity to bring these issues out into the open, and the willingness of the players, the stakeholders, to be open to solutions. So right now, wala muna akong masabi na ito yung magiging solution, pero gusto ko lang mag-shine ng light doon sa problema rin ng internal migration. Tapos, lahat ng profession, the second point that I want to emphasize is, lahat ng health professions merong sarili-sariling or kanya-kanyang roadmaps. Nursing has a roadmap, physicians have a roadmap, medtechs, etc., pharmacists. So kailangan siguro right now would be a good time to harmonize all this. Kasi before, when we did all the roadmaps, before the pandemic, wala pa itong pandemic to really push us to think as a group. We were thinking of our individual professions. Pero now, we realize we cannot do this alone, in silos. So, we need to move together as one big team to identify our priorities, to ensure that all our efforts are harmonized to improve healthcare for Filipinos. Thank you.
Dr. Montacar.
Right. Thank you very much. So, well, for me, I think susundan ko yung sinabi ni Dr. Lorenzo. It's very important really given the decentralized health system that we have. Somehow, it actually really, in a way, compounds the problem in terms of our human resources for health. So most solutions actually would focus on really creating or enhancing or maybe the political will of leaders actually in terms of really supporting the needs of healthcare workers. Really that they are actually a big solution to solve several issues na na-experience ng ating mga health workers. Like for example, Dr. Lorenzo and Dr. Brach can actually may correct me. I think it's more healthcare workers are in the public sector than in the private sector. And there are several healthcare workers that are working in primary care than in hospitals. And their needs have certain peculiarities. And one solution will not be applicable in addressing problems no sa primary care setup, nung nasa hospital. So we really need to, well, work on with our mayors, governors, leaders in respective healthcare facilities. So it's somehow, we just don't look on ano yung na-experience ng HR, but external factor that actually further drives yung mga problems na hinaharap nila. And at the same time, maybe I would link with what I'm going to say with what Dr. Borromeo had mentioned. You have migration from internal, from public to private, and at the same time, private to public, sorry. Then at the same time, you have rural going to urban areas. So there's several programs actually created right now that DOH is really active on that. Ano? How can we really entice our healthcare workers na hindi lahat ang manner of thinking, once I graduate, I would want to work in Manila, in Cebu, but how about areas like, for example, Mimaropa, Region 4B, which is a geographically isolated province, Barm, for example, other provinces, a mountainous region. So how can we entice and how can we maybe incentivize healthcare workers to really opt to stay and serve the people? For example, the Department of Health has Doctor to the Virus program. I have several students also doing that. After their stint, ang nangyayari sa kanila, they will opt now to leave that particular place kung saan sila na-assign. Ano? So there are very few individuals who will be staying in that locality. So what would be the mechanisms that entice them that after their DTTB stint, they will stay there and serve. How can we retain them even in a rural area, lalo na kailangan sila. Kailangan sila ng mga tao doon. I've experienced like some people haven't seen even a doctor pa. So there are some areas na gano'n. And so we need to also take care of these people, and we need quality trained healthcare workers that will opt to stay in such areas. And hindi lahat ang titig is lahat sa urban area lamang or working in a hospital regardless in a public and private. So, well, there are policy mechanisms being designed right now or related, but also there are struggles in terms of really implementing it and at the same time monitoring. At the end of the day, we need evidence, we need data to guide us with our policy making, policy implementation.
Dr. Manara, thank you very much. Because you raised that concern about the recommendations on how to retain health workers, we want to elicit ano po ba yung mga naging results ng mga RTD, ang mga shinare ng members ng roundtable discussion on what are the non-financial and the financial needs of our health workers so that they would choose to stay in the Philippines or they would choose to stay in the rural areas or in the GIDA areas. Instead of going abroad or migrating to the urban areas where there are more health workers. Anyone sharing those that came from our RTD? Dr. Lorenzo.
Yeah, yesterday, this was discussed also by our WHO health policy representative. No? We have to be mindful that we're working within a health labor market framework. And he was saying, and I think most of the participants yesterday agreed, that there has to be incentives. There have to be incentives not to be crafted to support that behavior. In some countries, if you are assigned to a GIDA area or a far-flung area, your pay is twice or thrice those that work in the cities, no? Where it is more comfortable, you're nearer your families. And then, on top of that, non-monetary incentives are you're given training, given access to masteral degrees or other competency-enhancing training that you otherwise would not get had you not served in that capacity. Those are, I think, very tangible ways, again, that are doable, considering that our market is very attractive as a driver for out-migration and for all this internal migration. So, if we were to follow the economist thinking that people will follow the money where it is. Then it's the incentives designed to be necessary. Can that be done and did it show results? The answer to that is yes. In Thailand, right now, they changed the incentives despite the complaints of other older health workers. The new health workers who were fielded to the out fields, no, to the far-flung areas, were really compensated well and given incentives for going there. In some places, they were given parang yung mga expat benefits of, transfer expenses. Then you're given relocation expenses, then you're given an apartment or a place to stay with. Talagang to show that you are appreciated. Here, I can give examples. No? I used to teach at the College of Public Health, and we did experiment with a position called Public Health Managers. And when our graduates, very young at that, did their work well, they were able to lobby for Magna Carta benefits for all their health workers. They were much appreciated by their mayors when they also came up with surveillance data. Would you know that in many of these places where they're served, the local government doubled the salary that DOH was giving them in appreciation for the way they served the local government. Remember that they went to poor communities, no? But these poor communities were able to give them that compensation monetary-wise, and then they were also non-monetary. The usual, no? Manok, talong, given to them. They were feeding them so that they did not have to worry about food. So, that is the lesson there. I think we do not have to think that we should compete with the first world when they poach our health workers. But we, within our milieu, can come up with measures that value our health workers, which are appreciated. And in some cases, some of our graduates stayed where they were and were enticed to serve continuously in those areas, and that is what we want. So there are simple ways of doing it, but technically the market forces are at work. We have to find ways to swing with how the money flows and provide good incentives for the health workers so that they can stay.
Thank you, Dr. Again, I'd like to follow up that question to be addressed by other members of the panel. Since we are College of Nursing for Educational Institutions and we belong to the University of the Philippines, how are we currently preparing our current and future students to not only fill space given the need for HRH, but also that our students, when they graduate, would choose to stay? I mean, pwede.
Okay. Yeah, exactly. It's not only for UP, College of Nursing. I think that's really what we want all the nursing schools should also take a look at. So it's not only the content exactly that we want to teach our students, but also I think how do we really want them to demonstrate, I mean, working in public health settings and making sure that the reorientation to primary health care is really going to be demonstrated at the end of the program, that they're fit for practice. So for example, in the UP College of Nursing, we have intensive practicum in community settings towards the end as a terminal requirement. So they need to live with families for family health nursing. And it's not only about families, but also about communities and organizing, doing health promotion activities, not only serving in rural health centers. So we do provide experience for urban and rural as well. And I know that in the past there were even immersions in really far-flung areas. So, but in the policy of the University of the Philippines, it has to be within 50 kilometers radius from the university. So, but we do have organized communities where, when I say organized, it's a continuous effort of the university, not only for the nursing program, but other programs as well like public health, medicine, allied medical professions, and dentistry. For these professions to serve in designated communities that are chosen by the university through the community health and development program. And where we can also demonstrate interprofessional education and collaborative practice. And I think that's a good model that we can also share with other universities and schools if we are to strengthen the demonstration of the competencies needed in public health. So I will stop there, maybe other.
Sa previous question na ano yung what will retain our health workers? Isa po yung nakadagdag na salary sa salary standardization, yung mga Magna Carta, yung mga benefits sa pinag-uusapan natin. Lahat po yun, nakukuha lang po ng mga regular employee. Pero yung ating mga job order at contractual ng mga health workers, wala po lahat yun. Yun. At yun po yung isa po talaga na issue na kung sila